And China changes gears on coronavirus curbs. Hopes are high for a return to normality as restrictions on quarantine and testing are eased. Let's now dig deeper into China's COVID policy with Donald Low. He's the director of the Institute for Emerging Market Studies from the Hong Kong University of Science and Technology. Mr. Low, all these months, years in fact, China has been very clear about the dire consequences of easing up of its COVID-19 controls. Now it is doing so. Let's quote a study from May of this year from Shanghai Fudan University, where they said they can expect 1.6 million people to die in about 3 months unless they see a ramping up of vaccination and improvement of access to treatment. Have we actually seen that happen between May of this year and December of this year to allow China to open up?
Yes, I think that's the major risk that China faces, that it's the most vulnerable segments of the population, the elderly population, are under-vaccinated. More than 40% of those aged 80 and above, which is really the most vulnerable segment of the population, are still not vaccinated. So I think the Fudan study still is very relevant. I think China's recent announcements to ease up on zero COVID comes at a time not of its choosing, precisely because I don't think its healthcare system is strong enough. And as I said, the elderly population remains quite under-vaccinated. It is really in response to the widespread protests a week or two ago that has forced the Chinese authorities' hands.
Mr. Low, the coronavirus, as we have all learned, is no respect of persons or politicians or leaders. It only adheres to the science. So the science we know of COVID-19, the coronavirus, do you think China is prepared for what might happen should it ease up on controls as it is seeming to do right now?
I think we're going to see a lot of regional variation on this. I think in the major cities on the coast where there are sufficient resources in the healthcare system, they might well be able to cope with the expected surge in cases. And also don't forget that the current subvariants of the Omicron virus may well be milder and may cause much less severe illness and deaths. So I think as I said, I think there's going to be we're going to see quite a lot of regional variation. In the inland provinces and in the poorer rural areas, we might see much higher levels of mortality and severe disease.
Because and this is not just China, any country, every authority has had to do this to stress that we may loosen up now. And here in Singapore, we've certainly heard that we may have to tighten should circumstances warrant that kind of tightening. Do you think China's leaders or its officials right now have laid out the picture clearly enough so that the public is able to accept a tightening of controls when that might become necessary in a very short while?
I think it's probably reached a point of no return insofar as its relaxation measures go. I think there's a great deal of not just COVID fatigue and fatigue around the very strict and draconian zero COVID restrictions. I think that there's a great deal of pent-up anger, public frustration at how the zero COVID policy of the last 2.5 years has wreaked a great deal of havoc on the economy and on people's livelihoods. So I think the Chinese authorities realize that, and I think it's going to be very difficult for them to dial back the loosening of measures that have been announced so quickly in the past week. But nonetheless, we never say never, and I think if the surge leads to uncontrollable number of not just cases but of cases of severe disease, of deaths, it's not unthinkable for the Chinese authorities to have to tighten up on COVID measures again.
On this tightening, for example, our correspondent earlier was speaking to us and she said the 10 easing guidelines are, in this instance, far more specific than they had been in the past. And that's a good thing because it means that local authorities will not need to interpret as they choose and take their own initiatives to tighten or loosen or fine-tune these policies. Do you see these guidelines working within a larger picture so that the public can see that China is not coming up with random, arbitrary moves just to please them, but as part of a larger epidemiological picture to manage public health?
Yes, to a large extent, I think the guidelines are welcome. They give a clearer indication of what China's COVID policy should be. But having said that, the local authorities, which are the ones that have to implement these national guidelines, they still have to make local decisions that are specific to their contexts. And I think the great risk is that for many of them, having not been told to prepare for this scenario of having to mitigate and having to live with the virus, they may well be underprepared for this sudden relaxation or sudden loosening of measures. Don't forget that for the local governments, last year and a half, 2 years, almost all of their resources have been devoted towards zero COVID, towards suppression. That means building quarantine facilities, isolation facilities. That means mass testing on a repeated basis. That also means periodic lockdowns every time there is a surge in cases. And given how those healthcare resources have been directed that way, I suspect there has been an underinvestment in the kind of things that they would need to do to deal with or to cope with a live with COVID approach. And specifically, I'm talking about whether they have sufficient hospital capacity, whether they have sufficient ICU beds, and of course, whether they have vaccinated the vulnerable segments of the population sufficiently. So while those guidelines are welcome, I'm not sure that for every local government, they are suitable. They are relevant to their, or they are the most appropriate for that locality-specific context.
Thanks for that. That was Donald Low from the Hong Kong University of Science and Technology speaking to us.